We've got a sense of urgency today, especially for our children. We have more children living in poverty in this community today than we have in recent history. In my view, there's an urgency to that. That urgency needs to be shared by the community, so as we work together, we move quickly and thoughtfully to affect impact on individuals' lives.
There's some new data we start looking at, and it's called food hardship rates. It's conducted by the Gallup poll every several years. They ask families, was there any time in the last 12 months when you could not afford enough food for your family? 1 in 4 families in Ohio answered yes. And when you look at that data by the cities in Ohio, Columbus has the 3rd highest food hardship rate.
We are very fortunate here at Life Care Alliance to be considered a statewide and national model for things that are working, programs that are working. Our Meals on Wheels program is not only one of the largest in the country, but we're still providing all the services that were intended from that program.
My full name is Harrison Denver Kirk. I come down here to eat 5 days a week, Monday through Friday. I hardly ever miss a day, and I just love it here. And I love their food. They have good food here, very nutritious, this and that. It'd be tough on a lot of people if the place is closed up like this. I know it'd be tough on me.
By providing Meals on Wheels and nutritious other meal sources to the elderly here in Central Ohio, our folks average 5 less days a year in the hospital than the Ohio and national average. Well, the cost of that is astounding from a taxpayer standpoint because Medicare and Medicaid is paying for it, but think of the benefit to the person. 5 less days in the hospital is a week. That means they didn't have some illness that took them there and has helped them stay even better.
We're seeing a huge increase in the number of grandparents who find themselves taking care of their grandchildren. We call them grandparent-led households. We had a grandmother who showed up at one of our pantries and walked up to the front desk and said, I need to change my family size. And when we said, well, what happened? She said, my daughter stopped by last night with her kids and said, Mom, the drugs have taken over my life. I need you to raise the children because I can't do it anymore. And I wish I could tell you that's a unique story, but it's not.
I'm the program director of the E.L. Hardy Center. There are a lot of kids in this area that don't get the proper nutrition. We started with 23 about 6 years ago. We've gotten to about 250,000 meals in last year. 90% of them are in single-parent matriarchal households. 70% of those households, the mother has not finished school. About 70% of them are on assistance.
Oftentimes people think of hunger and they think of these emaciated children in third world countries. But hunger looks different here in the United States, and the reality is those who are hungry are often the ones who are overweight and undernourished. When we think about in the beginning of the month, maybe their parents have SNAP benefits and are able to go grocery shopping. And maybe after a couple weeks of not having much and food being scarce and eating smaller portions, that first of the month, they might be binging. Or, when they do go to the store, the choices they're making, when you don't have readily have food available to you, what are you going to the store and wanting to purchase? You want to get the best, the most bang for your buck. And oftentimes that's a tough decision for parents to make. They want to make sure there's food available, so nutrition isn't always top priority. It's a single mom who has 3 kids she's trying to feed, and she's working 3 jobs. And her daughter becomes sick and she misses work. She loses her job. And so it's even harder to put food on the table and to make ends meet. And so, what we're seeing is this impact of food insecurity linking not just with the children, with the adults and the family as a whole. And so how can we combat those issues as a community?
We understand the fact that people are working, playing by all the rules, yet are hungry. We know kids go to school hungry. We know people go to work hungry because a spouse may have lost their job. I don't think that's what we want to create in a community. If we want to thrive as a community, we've got to change this model so that people who are working, playing by all the rules, have access to good food, have access to quality health care, and have a way that they can take care of their own families without having to go to a pantry. It really is about having a conversation as a community as to what do we want to aspire to be as a community.